of our other patients. Who can do that? Can we think smarter and wiser? Can some of these patients be transferred to somebody else? Can some of them be discharged? What can we do? Well, to do all that, you need somebody to be able to come and call and do all that phone call. So is there somebody there that could do that? Maybe it's a non-nursing person. You can work smarter. Maybe it's somebody in staffing that can do that has just that incredible skill to do that. It's a really good way to work smarter in the workplace. Really good way. So I think as the people that have the voices to do that are the staff nurses. They're phenomenal in doing these things and making really great ideas. Okay, strengthening leadership skills. Back to that. Here's a quote: "Directors should be more available to help new managers with disciplinary action. They need more support and more help in this role." You know, I think sometimes that when we get to be a manager and a director, and I've been both, that we are so overwhelmed with the productivity, the budget, the numbers, and things that we need to do, that we need to step back and get in the workplace and see patients. I know that when I kind of did rounds with the nurses and rounds with the patients every day as a director, it was incredible because they see you're there, they see that you want to change. What can I do for you? What do you need? You know, is there some piece of equipment that just doesn't work? Is there something that we're wasting that we can go back and collaborate with our friends in central supply and purchasing to say, this is just not working, this is wasting time, more time. Is there something that we can do that saves time? Let's look at those things too, okay? Now, managers need more help in learning how to enforce rules and follow through consistently with the unprofessional staff. And what that they mean is maybe the nursing assistants, ancillary people that are working, you know, that have people that aren't quite doing their duty, that you can follow through with that. And I love Dr. Leo Buscaglia, who talks about, he's from University of San Francisco in California, and talks about how do we get the best work out of people. And it's by looking at them, and this is one of the magnet characteristics. Are we giving adequate positive feedback to somebody? So what Leo did is he had a group of students that one class that he went and just gave them, when they did good work, he just didn't say anything. Another class that he went, when they did good work, he would go and he would touch them on the shoulder. One group that he would just say, wow, you rock, really exponentially increased in their performance and their outcome when they said, you did a great job and you rocked. The group that was just touched and said, good job, they did great too. The other one that just did a job because they were doing their job didn't excel and didn't do more performance and weren't quite happy. We all need feedback. That's why we like bedside nursing, because we get our feedback from our patients. They just say, oh, thank you so much, or you helped me so much, or we hear later, or you get a little note that said, oh, wow, that nurse was just so incredible. And it's like, you know, what did you do? You didn't do anything. You were yourself. You were your compassionate self that overflowed on the patients. Or maybe you had insight into what they needed and what they needed to hear. Maybe you just listened. So there's lots of different things that you do that we love. So what can we do to each other? Anybody watch that show? It's just a new show for me, even though it's old, called Bones. I've got hooked on that lately because of the teamwork there. It's that cultural anthropologist who works in a science lab. It's amazing. When somebody does a good job, they'll say, wow, you are brilliant, good job. We do things 100 times more than these bone people do, but I don't ever hear, this is like you hear in a report, the nurse said, well, I identified that, for the past 2 days, this person has missed their potassium and it didn't get taken off in the orders and there was a problem of it. The nurse listening to that, says, oh, okay. No, you know what we need to say? Good job, brilliant work, strong work, outstanding, incredible. You are the greatest. And that's what these people say to each other. And they say it sincerely because it's always attached to something of who they are or what they did. It's not like, oh, you just look cute today and you're always so sweet and nice. No, it's related to that. Wow, what you did for that patient and how you connected with them was phenomenal. and you had the insight and you were able to draw out that in the patient, and that's phenomenal. We need to say that more to each other. And even just small things like, you are so kind with how you present yourself. And you can say that to your managers, you can say that, and even if one time somebody really grouchy switches and was really nice, grab that moment. That's that transformational teaching moment that you can grab that and say, when you said that to me, it made me feel so good. Thank you so much. I really needed that. And I love that, how that shows. I recommend it's on Netflix. Download some of those and see how they interact with each other, because it's phenomenal. It's phenomenal. I think we need to say that, wow, you make a difference, you rock, you're incredible, and say why they are. Something they did that day. Wow, you remember to get that lab work. Oh, it's change of shift. You did that for me, and it's not even your job. Or maybe, I love that when these people come on shift for report and they're all fresh and new and they look so fresh, and we look so worn and we're tired and exhausted, and they said, you know what, let me get that med for you right now that you're a little late on. Let me get it and do that for you. I love that. Say, you rock when you come and help me to tie up my loose ends at the end of a long day. Appreciate that. So important. Those things are important. So help each other out. It really makes a difference. And that flows into the next category, which is rebuilding relationships. I'm going to talk about the 4 agreements, and I do have to say, because this is a contact hour thing, that I don't have any business agreement with the 4 or financial gain from the 4 agreements or from the Netflix bones. I just think that you can learn a lot with relationships. But the 4 agreements, I bought them. I get them for a lot of friends and nurses now. It's a book, and the book I didn't quite like as much as the cards. They're little colored art cards, and the 4 agreements, it's a general wisdom that I think if we could add to our life. I think there's some gender issues with these agreements, because I think the way the human female brain works is so different than the male brain. I think it tends to be, in my experience, that the female brain, and there's a book called The Female Brain and the Male Brain, which are phenomenal in this, that talk, the female, we tend to take things a little bit more personal, and even if it's not addressed personal, if it's a professional issue, we tend to take it at heart and to take home and think on things a lot more, and in general that tends to be a little bit more female characteristics. So the first agreement, and these cards, there's like 10 agreements, or there's 4 agreements, but there's 5, but there's cards for each one, that just inspirational cards that help you. But the first agreement I absolutely love, and when we're talking about rebuilding relationships, that nurses across the nation say that's so important. They want to rebuild the professional relationship between the team and rebuild that professional relationship, especially with physicians, where they're looked at with respect and where people hear their voices. Really important. That's going to increase our satisfaction, and it actually is related to patient outcomes too. So the first one is, let your word be impeccable. And to me, let your word be impeccable means that I am speaking the truth when I, even in report with my colleagues, that I don't gossip, that I don't repeat things that might hurt somebody else, that might be taken with my opinion and twisted a little bit. So be impeccable with your word, absolutely impeccable. And it's no different than with a team. So think of your team and think of different shifts and different days and different cultural contexts and climate. That I love that thing when you were a kid, when you actually sat in kindergarten, you said a statement, like, my dog has fleas, and you go down, another person repeats it and repeats it and repeats it, and goes all along the group, and it doesn't have anything to do with the original context at the very end. So very, very important that you speak clearly and directly to the person involved in your situation. When I was in Kansas City, Missouri, they had at St. Luke's Hospital a campaign that was commitment to coworkers, and I really appreciate that. We all got this card that we had to speak out loud, that I commit to you that I will do 100% my best work. I commit to you that I will speak directly to you, that if I have any concerns, that I will tell you directly. I will not walk and talk behind your back. I will not go directly to the nurse manager and up higher levels. I will not add to this fire. And I thought that was really incredible, because once you verbally say that out loud and commit to other people, it's something that you will stick to your word with. It makes you go to them first with that ear technique, and on little things even. Sometimes we're so busy and we're running in the hallway and we're communicating while we're running in the hallway because we're so busy. And it's just not the best situation. I think you need to take a deep breath and take a minute and try to use that ear technique, because people misunderstand things when you do that. And I think they feel like you're kind of yelling at them if you don't do it in a better setting. So if you need help with a certain patient in a certain room, just sit, look at the person eye to eye and tell them, say, I know you're busy, I'm really busy, but I have a need immediately. I'm giving blood and I have a blood reaction and I need to deal with this. Could you please watch my patients in these rooms, but this person's having pain. I really need you to give him a pain pill if you would. So there's one due now, and if you could go give it and document that, that would be great, and assess his pain. And then follow up, it's incredible when I get caught up, I'll help you out. Okay. So follow up with those things by just, I think those techniques really help you rebuild your team. So speak impeccably, speak honestly, avoid gossip, speak directly to the person. Be impeccable with your word, okay? The same way, on some of these inspirational cards, they will say other people aren't always impeccable with their word. So if they say something to you that could be rude or short or abrupt or judgmental, don't take it on. It's not necessarily true. It could be about their reality, their issues, and everything what they're going through. So one of the other ones is don't take anything personally. It's not about you personally. It's about everything else in their life. For example, I had a nurse I was working with who just wasn't getting her orders off very well at all. In fact, was missing some. And everybody else just said, oh, that she's not attentive to that, she doesn't want to do that, she's just not helping us. And once I sat down and really talked with her, her husband had left her just the past 2 weeks and wanted a divorce, and she had 2 young children. And I think that things like that are really difficult. So we need to find out, I'm not saying find out everything in somebody's life, but I told her, you know what, if you would have shared that with me, or that you're having family problems, I would have had somebody back up your orders, check your orders for you, do your orders for you, and make things a little less stressful if you're not thinking clearly because you're so stressed out. I'm so sorry that you have to go through this. You're a really good nurse, and you're so sharp, and you know what? This is stressful. Give yourself a break. Let us help you. So falling back on the team, right? It's wonderful. It's beautiful. It's a gift. We all have to be there for each other. So don't take anything personal. Find out what's going on. I love one of the sayings on the art card is, don't even take personally what your subconscious is telling yourself. Oh, you look fat and ugly today. Oh, those wrinkles. You're just looking pale, and you're just not a good nurse. You haven't been able to do all the things that you can do. Your mind is saying, and you were an hour late on this med, and that made this late, and somebody was sitting in poop. You didn't know it, and there were just all these things that you have to do. We're multitaskers by nature, so don't listen to that voice. Say, I am doing great. Tell yourself, don't take it personal what your subconscious tells you. Guess what it says on that? Because it's not even true. What you think about yourself is not even true. Other people's perceptions of you is not even true. It's true for them in their context. Okay? Don't take on anything else that you have. And one of the things they say is don't even take somebody else's poison. Don't accept it. Don't accept it about yourself. Find out what's going on with them. Maybe it's somebody saying, you don't do this and you don't do that, and go back and say, you know what? I understand that we're really stressed out today and that we're really, really busy, but we need to really be positive. And let's today, if we can, I really appreciate it you just to tell me how great I am all day, even if you have to lie to me, okay, in your perception. Say, you look good, you look great, you're a great nurse, great decisions, and boy, it lifts you up. So I think you can agree to do that, say, but even there was like 10% of people in the nation that are negative, and there's an article on pursuit of unhappiness. There's just going to be those crabby people out there. Don't take it on. You just rise above it and see if you can actually have them be a little bit positive and try to be a little positive with them too. I think that works out. So we got a long way to rebuild relationships, a long way. So the thing that I'm concerned about, and the thing that you really love about magnet hospitals, is that they don't get that magnet status unless they demonstrate that they really are a team, and the team falls back. And they have all sorts of other criteria too. But you really do have to have a strong collaborative team preceptor program. You have to show that you are really good at nurturing and that you've used evidence-based practice strategies within the workplace. So that's really so important to get that. But these magnet characteristics, and you have a list of them, are incredible. But one of them is being positive to each other, supporting each other's growth and development, supporting somebody's professional goals. Really important to sit down and say, what is your professional goal? Do you want to learn something new? Or B, how can I help? How can we help support you? And that's really great within an environment, especially if you do have a clinical specialist or people in education that will help you meet your goals too. Because I think that you're willing to take on new things and study different things at home if you're meeting your own personal needs. And that's kind of part. What does the team really need? Do they need an expert in this, an expert in that? You know, branch out, do other things. You know, give people titles and assignments that they're the person that's so good at this and will help us with different things. So this nurse says in team building, she says that in general the participants identified collegial relationships had deteriorated due to the stress of the work environment. And isn't it so sad, because since we treat patients as absolute number one, which I don't know if the A&E Code of Ethics definitely supports that, because if you don't take care of yourself, you can't take care of patients. If you don't respect your team, you can't take care of patients. So my interpretation, I'd love you guys to discuss this and see your ideas, is that they're all equal. Patient care is equal to you taking care of yourself. Well, we're not there right now in this environment. And we're not there as supporting each other too. But it says, due to the stress of the work environment, the high acuity, the lack of leadership, and the lack of time. So these are things that really need to be addressed. It says the foundation of a good team was the manager, and strong leadership skills are so important. And there it says here that unless this role of manager is strengthened by education and training, your team is going to remain dysfunctional. That means that we all, no matter what role we are in our own leadership, when I say the word leadership, I mean you, because managers are in a managerial role, but we all have to have leadership. And you know what? Many times there's a staff nurse that has much better leadership skills than anybody else. Okay, so I think we all need to find our expertise. Here's what a nurse said: RNs do not have a collective voice here. There are different sides, and there are ups and there's downs, and it trickles all over throughout the pyramid, the hierarchy pyramid. The manager is not supportive of us, and we don't have RN-only meetings. We do not go to quality or patient care conferences. We do not get to participate in many leadership things that nurses directly have a voice on, because management doesn't support us. The nurses say things like, this is your patient, not mine, and this attitude trickles down from the top. This is your role, not mine. So in collaborative team model, we all share the role, and we all support each other. And you know what, I think we got to think outside the box. What are things that non-nurses can do to help us, in our daily job, and help us unburden the role that we have? So rebuilding the team, let's jump back now to assumption number 3 of the 4 agreements. Do not make any assumptions. And, our job is making assumptions. That's what nurses are really strong about. We make assessments and we make assumptions. But when it says do not make assumptions, it's on how somebody else feels or why they feel or why they're doing something. Unless we know their whole story, where they've come from, their family background, unless we know what they went through the past 24 hours, what these new mothers come through and getting their kid to daycare and they're breastfeeding, kid poops all over them, or, somebody might be being abused at home. Somebody might have a child that's ill. There's so many different things that happen, and I think that we need to be much more aware that we're human beings. We can't just turn off that side of us at work, and we don't want that, because that human holistic side, that spiritual and in tune with other people is so important. But many times nurses will set aside what's going on in their life so that they think they can be more therapeutic at work. But you know what? I think it's good to have a little awareness and just to tell people, hey, I've gone through an awful lot. This is not, if I'm being a little bit more grouchy today, it's really not about you. Please don't take it personal. Okay? So I think we can't make any assumptions, oh, this person did this and that's why they did that. Rise above that. Move beyond that. And for my life, I really love having one person, a colleague, that's away from work, and I'm lucky because I have Susan De Pasquale, that we can talk about things in a professional manner, and she doesn't know people I work with, and I don't know really the people that she works with, although I got to meet some of you guys, but you can talk about professional issues and not take things personal, and you can address that, hey, I think you're taking this personal. Do you really know that for a fact, or are you making an assumption that this is what's going on? So I think it's really important to have somebody that you can talk to that's not in your workplace. Because guess what happens in your workplace? You violate that professional agreement to your coworker that you're talking behind somebody's back. And so I think it's important to say, hey, because somebody else has a whole different light, and say, hey, this is not even about you at all. It's about that person. So just let it go, and maybe that person's going through stuff that we don't even know about. So don't make assumptions. Have a private person that you can talk with. Heck, you probably met people all over the United States, nurses, or somebody that you have that lives across the country that you can share and talk with. Really important. Have coffee or tea with somebody that you can talk to that's not in the workplace. Although, in the hospice study, they really felt like the workplace people, if you got together outside the workplace, that it was very, very healthy. But you're not getting together to talk about other people. You might go have coffee, go have some wine with somebody, go to the art walk. A few people at group might go and do something together. So if you're into that, that really does strengthen some of those relationships. You're more willing to support the person. But now if you don't want to have any ties with anybody at work, I think that's fair enough too, and that's understandable, because a lot of people don't also. I just wanted to tell you that the hospice people did say that's really important. So to wrap this up about striving to be heard and recognized, I think that's all we really want, is to be recognized and to have somebody say, this is a job well done. Maybe you could kind of fit it in at the end of the day or during the day, if you could spontaneously add that to your practice, is really, what has this person done that's phenomenal? And maybe some of you guys are natural at that, but let me tell you, for you that aren't and have never done that and really like to critique people and say, hey, you can do that better, I'm that way, because I am an academic educator who's constantly looking, how can we improve things? So it's hard work for me to say, hey, you're great, you know how much I appreciate you. And maybe if you're that type of person, that you have to slowly get into this and just start thinking about the people you work with and what are their real strengths, and how can you do this and say, you know what, have I ever told you that that this is what I really appreciate about you? So I do recognize that, and recognize your voice in your professional accountability to keep that relationship healthy. So how are we doing for time, Susan, on this?
You're doing great.
Okay, so the fourth agreement, and then we're going to move on to some teaching styles. The fourth agreement is always do your best. I don't have any problem with nurses on this. All the national studies show that nurses in every situation will always do their best under the circumstances that they're in. They will always do their best. I'm not saying it is the best they could do, but you know what? I think you need to leave work saying, I set some priorities. I didn't get any baths done. That person didn't get this dressing changed. And there's some things that you have to give up, but you have to be able to say, I did my best. I did CPR on that person, or I sat down and talked to somebody who was newly diagnosed with cancer. I was able to help a parent with a child that was croupy and really talk about the things they were afraid of. You set priorities, and I value your priorities, but your priorities might not be the same as your coworker. But I want you to embrace that. I want you to embrace that, there was a nurse that I worked with that, let me tell you, the nurses didn't like him because his rooms were all trashed out at the end of the day. But let me tell you, his patients and families got full education. They got everything they need. If your strength is cleaning out a room and organizing it, then go for it. Just embrace people's strengths and know that their weakness might not even be a weakness. It's a weakness in your eyes, maybe, because you like a clean and organized room, but you don't really know the outcome, the lifelong outcome that maybe that nurse made on that patient's life or family. So really important. Always do your best, and I know that you always do your best, so that's a given with nurses. So let's move on, and I want to talk about preceptors and some of the problems that I've had, because as a clinical specialist, I was in charge of a big hospital in Kansas City, Missouri, St. Luke's, of matching up preceptors with preceptees. A huge program that we had sometimes 24 orientees at one time. And really important to look at people's personalities, and there was a lot of failures that we had, and at that time we just looked, who's the strongest nurse, who's the most experienced nurse. The nurse that was most experienced, I hate to tell you, under Benner's model that we've all looked at from novice to expert, is not the best person to orient. In fact, I have found in the past 2 years that even senior nursing students doing their big preceptorship, if I can get a nurse who's out 2 years, they're the most phenomenal teachers because they know what it's like. They do things step by step. And we know that experts jump over those 10 steps and they don't even know why. Intuitively, they go in and they assess a person, they multitask, and they can do everything. And they just do things, and it's really hard to articulate. So, and everybody is different, learn differently. So recently I had a young man who I connected with on the oncology unit with a nurse, and I always have them fill out these tools. But the problem is sometimes you have to fit somebody with the nurse because it works best with staffing, and it works best with a certain nurse. And so what I do in that case, I don't get to say, oh, this person is this type of learner, this type of teacher. I just lay it out on the table, and I meet with you could meet with a new grad and or the new orientee and meet with the preceptor, and to have them do the learning styles survey and have them share their results about how they learn best with the other person and vice versa. Well, these one, I didn't get to do it the first day. I always do it before, and I recommend always do it before you start with the person, because there'll be misunderstandings if a person is a total visual learner and the other is an auditory teacher. So if they're telling everything and the person really needs to kind of see stuff, or if they're tactile and they need to look and touch and visual versus just an auditory. So the student was not an auditory learner at all. This person was totally visual and needed to see things. And so we met after the first day, and she goes, oh, well, I knew that. I just thought you weren't listening to me, what I had to say, and I had to repeat stuff. When they were looking and taking off orders, she'd sit and talk to him about, this is how we take off orders, this is how we do. No, he needed to look at the order, he needed to have the computer there, he needed to look how to enter things, and that was important for him. That's how he learned. So what I would like you guys to do is to know the importance of this, and within your organization, really look at this and have it on file. So I actually will keep this on file now for of the people that I know that I use for lead preceptors, and I know how they learn, so they don't have to redo that. But I love this because when you look at visual learners, and it's on the handout called What Are the Types of Learning Style? And I do need to give a tribute to Carol Endres at Wright University, because they developed this. But visual learners, they learn through seeing stuff. And these learners, they need to see the preceptor's body language. They need to look at facial expressions to understand the content. Really interesting. So if you are a